Knock, knock. Provide privacy. Hi, my name is Trayvon. I'm going to be the nurse today. Here to do a newborn assessment, head to toe assessment. Before we get started, just have to verify the baby. And mom, can you verify mom, baby's full name and date of birth, please? All right. And I will match it with mom's wristband. Okay, that'll work. All right. And a pair of gloves. All right, mom. Like I said, I'm just here to do a head to toe assessment. So it's gonna cause me to, like, move the baby around, and she may cry a little bit, but it won't hurt. Okay. The first thing I'm gonna do is assess the baby's apical pulse, skin to skin with skin and stethoscope. Assess the apical pulse for 1 full minute. Listening for any abnormalities or murmurs. Okay, time has lapsed. Heart rate should be between 110 to 160. All right. Also, I'm going to be listening to breath sounds in 5 different spots. Moving right to left, and then right. Okay. Lung sounds are clear, anterior. I'm also going to assess lung sounds posteriorly. Same fashion, right to left, right. Right. Lung sounds are clear. Also, I'm going to listen to bowel sounds in all 4 quadrants. Moving from right lower quadrant clockwise to right upper quadrant to left upper quadrant down to the left lower quadrant. All vowel sounds are active as well as normal. All right, and after that, just going to quickly assess the baby's temperature. Thermometer should be parallel with the skin, with the body. Just to reassure accuracy, baby's temperature should be from anywhere from 97.5 to 99.5. Okay, that is normal. Okay, and now you're gonna unclothe the baby for a little while to assess the skin. Assessing for any bruises, lesions, abrasions, or birthmarks. None noted. Also assess the skin turgor on the near the clavicle. Skin turgor is fine. And also going to assess, moving from the head down, going to assess the suture lines and the anterior and posterior fontanelle, which should be soft and flat, which both are. All right, and moving down, gonna go to her eyes. Her outer campus should be aligned with her pinnas. Her sclera should be white, which they are. Conjunctiva is pink and moist. Nares are patent, no mucus or obstructions noted. Lips are pink and moist. And also, while I'm here, I'm going to assess the root reflex, and that'll just be a slight swipe of her cheek, and her head should go towards my finger, and it does. And with a new pair of gloves, clean pair of gloves, wash my hands. Going to assess the baby's sucking reflex and the fusion of her palate and her mouth. And the baby should suck as I put my finger in her mouth. As I remove, I'll assess the fusion of her palate on the roof of her mouth. Fusion is there and intact, and sucking reflex is intact. Okay, moving down, no respiratory distress noted. Even rise and fall of the chest, and no nasal flaring. I'm going to palpate the abdomen from right lower quadrant to right upper quadrant, left upper quadrant to left lower quadrant. No distension or tenderness noted. Also going to assess the brachial pulses. Strong equal bilaterally. Now moving down, just going to assess her palmar reflex, and she should grasp my finger if I put my finger in her hands, which she does. I'm going to assess the femoral pulses, which are strong and bilateral, and her pedal pulses, which are strong bilateral. And since I'm actually at her feet, I'm also going to assess the Babinski reflex, and her toes should flail out, and they do. And their palmar reflex, toes should curl towards my finger, and they do. Alright, and just going to turn her around and assess her spine and her sacral area. Her spine is aligned, no sacral dimples or tufts of hair noted. Hair distribution is even and normal. And I'm just gonna uncover the baby to assess for to reassure her majora is larger than her minora. Since she's a female, if she was a male, we would assess her incision site to make sure there is no drainage, leakage, or anything abnormal. And everything's normal. Her majora is larger than her minora. We'll just cover the baby back up, reclothe the baby. Before I do my teaching, I would do another reflex test, which would be the Moro reflex, where I would kind of startle the baby, and her arms would flail out and then come back midline, and that is also normal. Also teach the mother about how many dirty diapers babies should have per day, which should be about 6 to 8 dirty diapers per day. And then you would just assess if baby has had first meconium bowel movement. Baby had first has had a bowel movement, and you would just explain that black tarry stool would be normal, what you're looking for. And you would ask if the baby has had if she's voided, and if there was any abnormalities in the void as well. And after that, you would cover the baby back up and ask mom if she would like for her to stay with her or to go back to the nursery with you. Okay, she's gonna stay with mom. And you'll just tell mom to call you if she needed anything.